Medicare Minute MD with Dr. Robert Hoover.
Hello, and welcome to Medicare Minute MD, a video and podcast series produced by the DME MACs for the benefit of physicians and healthcare providers. I'm Dr. Robert Hoover, Medical Director at CGS Administrators, the Jurisdiction C DME MAC. This series of videos, also available as a podcast, are tailored to provide important Medicare policy information for physicians and other healthcare providers who prescribe durable medical equipment or other services when treating Medicare beneficiaries. In our video series introduction, I compared reasonable and necessary determinations with benefit category decisions. Today I'm going to dig a little deeper into one of the benefit categories administered by the DME MACs, surgical dressings. I encourage you to read the entire local coverage determination and related policy article on surgical dressings for additional information. Coverage of surgical dressings is an often misunderstood benefit because everything that practitioners clinically think is covered as a surgical dressing may not be covered by Medicare. It is important to note the surgical part of this benefit category's name because it's critically important to understanding the limitations of this benefit. To be considered for coverage by Medicare, a surgical dressing must serve as a therapeutic and protective covering applied to surgical wounds or debrided wounds. Debridement of a wound may be any type of debridement, surgical, mechanical, chemical, or autolytic. Dressings used for mechanical debridement to cover chemical debriding agents or to cover wounds to allow for autolytic debridement are covered, although the debriding agents themselves are non-covered. Surgical dressings include both primary dressings, that is therapeutic or protective coverings applied directly to wounds or lesions, either on the skin or caused by an opening to the skin, and secondary dressings, or materials that serve a therapeutic or protective function and that are needed to secure a primary dressing. Now that you've heard the basic criteria to be considered for coverage under the surgical dressings benefit, you can better understand why the following examples shown on your screen are considered non-covered under this benefit. As you can see, the examples given are either situations where there is no surgically created wound or the wound does not require debridement. Medicare also does not consider as surgical dressings things that are used to cleanse a wound, clean intact skin, or provide protection to intact skin. In addition, antibiotic-impregnated dressings or items listed in the Orange Book for drugs are considered drugs and non-covered under this benefit. Finally, irrigation supplies that are used to irrigate the skin or wounds are also not covered under this benefit. While a particular dressing may not qualify for coverage under the surgical dressings benefit, it may be eligible for potential payment under a different benefit category. On your screen now, you'll see some examples of other benefits under which dressings may be covered. For example, dressings used with a feeding tube are covered as a supply to the tube and enteral nutrition and are reimbursed under the supply allowance for that benefit, not under the surgical dressings benefit. Now let's think about two of the more commonly prescribed surgical dressings, foam dressings and collagen dressings. A foam dressing is a sterile, non-linting, absorptive dressing which is made of open-cell medical-grade expanded polymer. It has a non-adherent property over the wound site, and the dressings come in many different forms and sizes. Foam dressings are covered when used on full-thickness wounds, for example stage 3 or stage 4 ulcers, with moderate to heavy exudate. The usual dressing change for a foam wound cover used as a primary dressing is up to 3 times per week. When a foam wound cover is used as a secondary dressing for wounds with very heavy exudate, dressing change may be up to 3 times per week. If you're using a foam wound filler, the usual change is up to once per day. Collagen dressings are products that come in a variety of sizes and forms and tend to be derived from porcine or bovine sources that are then rendered non-antigenic. The primary function of a collagen dressing is to maintain a moist wound environment. Collagen-based dressings, or collagen wound fillers, tend to be used on full thickness wounds, for example, stage 3 or stage 4 ulcers, typically with light to moderate exudate. Rarely, if ever, are collagen-based dressings used for wounds with heavy exudate, severe burns, or when an active vasculitis is present. In addition, you often see collagen dressings used on wounds that have stalled or have not progressed towards a healing goal. Many collagen dressings can stay in place for up to 7 days, depending on the specific product. So to summarize, the surgical dressings benefit has some limitations with regard to the type of wound, surgically created or debrided, and the types of products considered for coverage under the benefit. In addition, while a dressing might not be covered under the surgical dressings benefit, there may be coverage under other Medicare benefits. And that does it for this edition of Medicare Minute MD. As a reminder, you can download and print a written transcript of this program. And don't forget, this information is also available on podcast. Our complete library is located under the Education menu on cgsmedicare.com. As with all of CGS's educational offerings, this is only a summary of certain policy requirements. I encourage you to read the applicable LCD and related policy article for a complete description of the coverage, coding, and documentation requirements. Thank you for watching and have a nice day.